What's up, good people? Welcome back to my channel, and in this video I'm going to talk about the complications of LASIK surgery. Remember, there is another video and there are multiple videos on my YouTube channel. You can go to my playlist and find out the LASIK surgery videos from there, because this is a very thorough video, but at the same time it has a lot of connection to my previous videos, so there might be few points where you won't be able to understand. If you have questions, ask me in the comment section or go to my playlist and check out my other videos, because they will help you understand this video in more detail, in more depth, because there is always a background of something that I'm saying that I have said in the past, and now I'm elaborating it. And this is a little complicated video, a little advanced knowledge video that I'm bringing here. I really hope that it is understandable to all of you. But again, if you're not able to understand anything, please don't hesitate asking me questions in the comment section. So let's move on. Microkeratome related flap complications. They're pretty common, but not 100% common. If they were 100% common, nobody would be doing LASIK surgery. But when it comes to the complicated LASIK surgeries, there we see microkeratome related flap complication, and amongst those, what happens is flap buttonhole can be formed, free cap could be formed, incomplete, short or irregular flaps could be formed, or some people can get corneal perforations. Sorry about the tongue twist, but yes, corneal perforations are serious complications. So these are the microkeratome related flap complications which can happen, and again, it does not happen to everybody. They form, the flap buttonhole can form when the microkeratome actually exits the epithelium prematurely and then re-enters. So it basically forms a buttonhole there, like a donut. So we all have seen a donut, and donut has a hole. So we are forming that kind of hole in there due to that re-entry, the premature entry, and causing that kind of damage. And this can happen in few specific scenarios. For example, when there is a suction loss, when there is a corneal scar before the surgery, or previous history of corneal surgeries, or steep corneas. Even steep corneas can end up with this kind of flap buttonhole. And large flap in itself is a problem. If you have a large diameter of a flap, that can end up with that flap buttonhole, which we don't want, okay? And let's say if the pressure drops down during the surgery, or the patient has a low intraocular pressure, then that can also lead to this kind of scenario, forming a donut hole thing called flap buttonhole. We don't want that, because it's a complication that can cause troubles to the patient after the surgery. And free cap, it happens, it does happen sometimes, when the entire flap is basically dislodged, when the entire flap is itself dislodged from the cornea. And this can happen if there is inadequate suction. If the suction during the procedure, during the surgery, during the LASIK surgery is not adequate, or there is a flat cornea, or there are defective blades that are being used for that surgery, or there is a decentration of the ring that we are dealing with. If that ring is decentered, then you can have this complication called free cap, which is not a good thing to happen to some patients, because they will hate their surgery, they will hate their vision after the surgery. So please talk to your doctor and tell them if you're having problems after the surgery. Don't just sit home and cry about it, and because that's not the solution, that's not going to help. And there is always some ways that we can help our patients after the surgery, so please check with your surgeon about it. Another thing is femtosecond laser related flap complications. Some patients can end up with vertical breakthroughs of the gas in there, or some people get anterior chamber gas bubbles. Some patients can get rainbow glare. I have a separate video on rainbow glare effect also, check that out. Anterior chamber gas bubbles, these bubbles could actually interfere with pupillary tracking, but usually they are self-limiting. Usually they go away on their own, which is a really good thing. The surgeon doesn't have to do anything, the patient doesn't have to do anything, and they are cured on their own. And they resolve over a short period of time, as I mentioned, on their own. And the rainbow glare effect, it actually comes when you're looking at a white light source, and it happens secondary to the pattern on the under surface of the flap. The LASIK flap that you're forming during the surgery, let's say this is your LASIK flap, let's say for the sake of description. The under surface of that flap has specific pattern forming from the LASIK surgery itself, and those patterns are causing the lights to scatter. Whenever you're looking in the white light like this, when the light hits those under surface patterns, the LASIK patterns, it causes the lights to scatter, and that we refer to as a light diffraction, and that's what's leading to that kind of rainbow glare effect in your vision. Mostly it's self-limited, but let's say if it's persistently there, not going away, please tell your doctor, please talk to your doctor, give them at least a phone call. Okay, the surgeon may be able to lift the flap and perform the under surface ablation to get rid of that diffraction that's causing this rainbow glare effect. You cannot live your whole life with a rainbow walking with you. Okay, so please talk to your surgeon about it. Don't just try to complain about it or cry about it. I know it's hard, but please first help yourself, then somebody will be able to help you. Okay, other thing is there are complications that can happen with whether the doctor used microkeratome or the doctor used femtosecond laser. So it depends. So let's talk about the common complications from both of them. The corneal epithelial defect can happen from them, or limbal bleeding can happen, or the interface debris can form or remain there from the laser surgery or the LASIK surgery itself. By laser I meant femtosecond laser. Okay, so the corneal epithelial defect, it can happen in case of older age. That's why if you go back to my video, one of my selection criteria was the age. But let's say an old patient wants the LASIK surgery, they can have more chances of corneal epithelial defect. Or a patient has a steep cornea with the previous corneal trauma, that will make it even worse. Steep cornea in itself will make the corneal epithelial defect possibly, not every time, but yes, it can. Previous corneal trauma, yes, it can cause corneal epithelial defects and lead to problems. And pre-operative hyperopia, if a patient has a plus prescription, let's say he's +5, +2, +3, whatever it is, but if he is hyperope, which means plus prescription in your sphere part of your glasses or contacts, yes, they are predisposed to the corneal epithelial defects. Diabetics are also predisposed. All of these things, if you look at my older video, my previous video, you will see that yes, I have spoken about these in my selection criteria, in the contraindications and stuff. That's why these are causing problems, because some surgeons, they do the surgery regardless of diabetic status and stuff like that, and I don't like that. That's my understanding, that's my take on that. And a history of contact lens use can also interfere with the corneal epithelium and cause epithelial defects. Increased corneal thickness is another thing. Even though increased corneal thickness is a plus point for a LASIK surgery, but beyond a certain level, if it's still higher than that, yes, it can be a negative thing in some cases. EBMD, epithelial basement membrane dystrophy, and a type of microkeratome that is used for the surgery, those also determine the problem that can happen called corneal epithelial defect, because this defect can lead to delayed healing of the LASIK surgery, diffuse lamellar keratitis, epithelial ingrowth flap striae, and infectious keratitis. That's why the corneal epithelial defects are not favorite thing for any surgeon. They don't want to see that because they cause these healing issues, flap issues, flap striae, infectious keratitis, DLK. We don't want that. We don't want that. So please stay in touch with your surgeon. Limbal bleeding. Sometimes if you see after LASIK surgery any bleeding on the edge of your eye where the black part and the white part are meeting, please tell your doctor that you see that bleeding spot. The people who are predisposed to that kind of bleeding are people who had large flaps used during the surgery, or those who had plus prescription called hyperopes, or those who had inappropriately or improperly positioned suction rings during that procedure, during that surgery, or people who had corneal pannus. Corneal pannus are not uncommon in the contact lens wearer, especially long-term contact lens wearer does have corneal pannus in many patients, if not all. So please be careful, because this bleeding could cause problems with the healing process. It can cause sterile infectious keratitis, or sterile interface keratitis, and decreased contrast sensitivity and glare acuity issues. So those are important. Sterile interface keratitis is an important diagnosis. So please talk to your doctor. If you see that bleeding spot, give them a phone call. When I have a post-LASIK surgeon, I make sure I look at that there is no bleeding, because what if it's a sterile interface keratitis? What if it's a problem that can lead to decreased contrast sensitivity? So please be careful about those, and remember those predisposing factors as well. Interface debris during the procedure, when a surgeon is creating and lifting the flap, the debris can literally accumulate within the interface. Usually it goes away on its own, but we try to be very careful. The surgeon has to be very careful, making sure that there is no leftover debris over there. Post-operative complications are important to keep in mind, because sometimes the surgeon might end up doing overcorrection and then you end up requiring glasses. The surgeon might end up doing undercorrection and you still end up requiring glasses. So that's the problem. This can happen because of the ablation algorithms, normogram ages, and the amount of refractive error that your surgeon is dealing with. That also determines the success and the amount of overcorrection or undercorrection that may end up with. Visual aberrations, they are not 100% common, but they are like 20%. 20% of the patients will report some form of visual changes. Flap creation alone can lead to a higher order aberration, glare. I have another video on this. Please check my channel on that. They can also have halos, glare, starbursting patterns around the lights and the haze, and decreased contrast sensitivity. The FDA reports that visual disturbances tend to stabilize. Usually they stabilize in about 3 to 6 months after the procedure, but important thing is stay in touch with your surgeon. Keep them calling. Keep them informed. Sometimes the flap itself gets some folds or striae. The flap can also dislocate. The risk factors for those dislocations of the flaps are excessive lid squeezing. Don't squeeze your lids after the surgery. Eye rubbing, excessive dry eyes, presence of epithelial abrasion, poor intraoperative response, repositioning, when we are repositioning the flap, make sure we have a good repositioning. If it's poor, it can lead to flap dislocation. Excessive irrigation of the flap during the procedure can also end up with the flap dislocation, or sometimes trauma. Trauma after the surgery is not good. It's not good. If you got trauma and still you're seeing good, you're lucky, but make sure your surgeon is aware of that. Okay? Dry eye. Dry eye. I think in my personal experience, I have seen more than 80% of the LASIK surgery patients getting dry eyes after the surgery. So if you also got LASIK surgery and you have dry eyes, please let me know in the comment section. And if you don't have dry eyes, despite of getting LASIK surgery, please let me know, because almost always I end up seeing dry eyes after LASIK surgery. And DLK, diffuse lamellar keratitis, if you want a full video on this, let me know, because it's a big topic. I will discuss it some other time, especially if you are interested. Let me know in the comment section. Another big section or class of complications is because of ectasia, the thinning happening after the surgery, and there are some rare complications that may happen, that have a potential of happening, but it doesn't happen to everybody. It is very, very, very rare to see those complications, and those I have listed in the end of this video. That PISC, pressure-induced stromal keratitis, epithelial ingrowth, keratitis, CTK and IK, infectious keratitis are possible. They don't happen all the time. Other class of rare complications are ischemic optic neuropathy, retinal detachment, vitreous hemorrhage, PVD, posterior vitreous detachment. They are potential, but again, they are very rare complications of LASIK surgery. Okay, in the end, look at the references. So I worked hard for this video. Please like, subscribe, and share to my channel, and ask me in the comment section if you have any questions. I hope it was informative. Thank you so much. Have a great day.